today I'm going to discuss the REBT or Rational Emotive Behavior Therapy. So these are the things that we'll be mainly focusing. But before we jump right into it, ipapakilala pa rin natin, of course, kung sino ba yung naging proponent nitong REBT. Rational Emotive Behavior Therapy or REBT was founded in 1955 by the American clinical psychologist Albert Ellis because of his dissatisfaction with his practice of psychoanalysis and with the person-centered therapy. He originated an approach that he believed would be more effective and efficient in bringing about psychotherapeutic change. His approach is primarily a cognitive one, although it has significant behavioral and emotive aspects. Albert Ellis was born in Pittsburgh in 1913 and raised in New York City. There, he received his undergraduate degree at the City University of New York in 1934. Between graduation from college and entering graduate school at the age of 28, he wrote novels and worked as a personal manager in a small business. In 1942, he returned to school, entering the clinical psychology program at Columbia University. There he started a part-time private practice in family and sex counseling soon after he received his master's degree in 1943. At the time Columbia awarded him a doctorate in 1947, Ellis had come to believe that psychoanalysis was the deepest and most effective form of therapy. So habang nagpa-practice siya ng psychoanalysis and psychoanalytic therapy between 1947 and 1953, Ellis became increasingly dissatisfied with it. So by 1955, Ellis had abandoned psychoanalysis entirely and instead was concentrating on changing people's behavior by confronting them with their irrational beliefs and persuading them to adopt rational ones. In 1957, he published his first book on REBT titled How to Live with a Neurotic, and 2 years later, he organized the Institute for Rational Living. So, to sum it up, Albert Ellis is notably known for the rational emotive behavior therapy, his writings on human sexuality, the ABC model, and as one of the founders of cognitive behavior therapy. Ellis enjoyed the study of philosophy. He was interested particularly in the Stoic philosophers and was influenced by Epictetus, a Roman philosopher who said, "People are disturbed not by things but by their view of things." So, dun pa lang sa mga words na yun, halos ma-embody na niya kung tungkol saan ba yung REBT. The philosophical underpinnings of REBT include responsible hedonism, humanism, and rationality. First, we have responsible hedonism. So, although hedonism refers to the concept of seeking pleasure and avoiding pain, responsible hedonism concerns maintaining pleasure over the long term by avoiding short-term pleasures that lead to pain. This point of view does not lead to a responsible behavior because individuals with a responsible attitude toward hedonism think through the consequences of their behavior on others as well as on themselves. Next is yung humanism. So kahit na parang ayaw na ayaw sa Ellis sa Rogerian psychotherapy, kita naman natin yung naging influence dun sa kanya. So there's this concept that I'd like to emphasize in comparison sa person-centered therapy. Sa person-centered, it was focused on the idea of unconditional other acceptance or sa mas kilala nating unconditional positive regard. Meaning, yung client, they could feel understood from being with the person-centered therapist, that there's another person that could accept them and that there's another person that could also be non-judgmental. On the other hand naman, REBT included the idea of unconditional self-acceptance or yung USA, meaning for an individual to really have the chance of being free of symptoms, kailangan daw muna they'd be able to accept themselves unconditionally. So, ang bottom line dito is, if other people can unconditionally accept them, it is good. But if somebody can unconditionally accept themselves, then it's better. Lastly, we have rationality. This refers to people using efficient, flexible, logical, and scientific ways of attempting to achieve their values and goals, not to the absence of feelings or emotions. Sa REBT, they will get to show the individuals on how they can get more out of this life by just being rational. There are also certain factors that are very basic to REBT. Isa na dyan yung biological factors wherein tayo daw mga tao has this powerful innate tendencies to hurt ourselves or to think in irrational ways. Ellis believes that individuals have inborn tendencies to react to events in certain patterns, regardless of environmental factors that may affect events, by damning themselves and others when they do not get what they want. On the other hand, sa social factors naman, ang interpersonal relationships daw in families, peer groups, schools, and other social groups also has an impact on expectations that individuals have of themselves and others. Ellis is also known sa kanyang ABC model wherein A is the activating event, B is the belief, and C is the consequences. A is the stressor, and the belief system is what a person uses to interpret that stressor. So, a stressful event happens. They're processed through a person's belief system, and then the person reacts. That results to the consequences. Consequences themselves can lead back to an activating event. So, this ABC cycle could be destructive or this could be used for positive outcomes, and that was one of the goals of REBT, and that is to help transform the ABC model that is going to occur anyway. There are always going to be stressors, belief, and consequences, but convert that model into something positive for the person. Another concept that is related to REBT is the masturbation. These are belief systems consisting of absolute mass and are also implicit in individuals' consequences. These are very interesting choice of words, ano po. So, must are a part of goals, activating events, beliefs, and ineffective consequences. Also, masturbating develops irrational beliefs and leads to emotional disturbance. Dryden and Ellis divide these irrational beliefs into three categories, the three main masters. So, we have, I absolutely must perform well and be lovable. Other people absolutely must treat me considerately and fairly. My life conditions absolutely must be comfortable and not too frustrating. Now this is from Ellis himself.
Right, the three main must are I must do well or I'm no good. You louse, must treat me well or you're worthless and deserve to roast in hell. And the world must give me exactly what I want, precisely when I want it, or it's a horrible, awful place.
Ito naman yung 12 irrational beliefs that Ellis often mentions. You could take a screenshot if you want. Now let's focus on the goal. The goal of REBT is to assist people in minimizing emotional disturbances, decreasing self-defeating self-behaviors, and becoming more self-actualized so that they can lead a happier existence. The major sub-goals are to help individuals think more clearly and rationally, feel more appropriately, and act more efficiently and effectively in achieving goals of living happily. The REBT assessment is of two overlapping types. The first is assessment of cognition and behaviors that are sources for the problems as well as themes of cognition, emotions, and behaviors, while the second is the use of the ABC theory of personality to identify the client's problems. So a wide variety of scales and tests can be used to assess client concerns. We could use the therapy-oriented assessment, the Milan Clinical Multi-Actual Inventory Tool, Beck Depression Inventory, as well as the REBT self-help form. Itong REBT self-help form, yung mga clients yung mag-enter kung alin yung activating events nila, consequences, as well as yung important irrational beliefs. Here is an example of that form. Dito naman sa therapeutic relationship, since REBT is pretty straightforward, Alice believed that the best way to develop a therapeutic relationship is to help solve the client's immediate problem. After asking the client what he wishes to discuss, Alice then identifies the activating events, irrational beliefs, and emotional and behavioral consequences. He may do this for at least 2 to 3 sessions and then possibly work on larger or other issues. The client then will see and hear that they are being listened to and responded to. The clients not only feel understood but also sense that the therapists understand their feelings better than they do. Dito na papasok yung application ng ABC model. Additionally, therapeutic interventions require the use of D and E, wherein D means dispute and E means effect. When beliefs have been actively and successfully disputed, clients will experience E, which is a new effect, a logical philosophy, and a new level of effect appropriate to the problem. In working with the ABCDE model, therapists can experience issues and difficulties in application to their clients. A is for the activating event. The questions asked could be what happened and what the patient perceived happened. This is the stressor. A few examples are family troubles, unsatisfying work, early childhood dramas, and all the many things we point to as the sources of our unhappiness. Next, B is for beliefs, especially the irrational, self-defeating beliefs that are the actual sources of our unhappiness. There are two types of beliefs. One is rational and the other is irrational. Rational beliefs generate adaptive and healthy emotions and behaviors, whereas irrational beliefs are exaggerated and absolutistic, lead to disturbed feelings, and do not help individuals attain their goals. Next is C, the consequences. These are the product of the cause. Few examples is the neurotic symptoms, negative emotions such as depression, panic, and rage that come from our beliefs. So kapag hindi ka experienced therapist, minsan mahirap siyang i-differentiate between belief and consequences. One difference is that feelings cannot be disputed. They are experiences, whereas beliefs can be disputed. A common and important approach in our EBT is to teach the ABC philosophy to clients and then to dispute the irrational beliefs. Disputing has three parts. First is detecting, discriminating, and debating the irrational beliefs. The therapist first detects the irrational beliefs in the client and helps the client detect irrational beliefs in his perception. So, detecting the irrational belief is the first part of disputing. Discriminating irrational from rational beliefs is the next step. Being aware of must, shoulds, oughts, and other unrealistic demands helps the client learn which beliefs are rational and which are not. Then a major emphasis in REBT is debating irrational beliefs. The therapist will ask questions like, why must you do everything better than everyone else at work? Why must you know everything that is going on in the office? Debating irrational beliefs helps clients change their beliefs to rational ones, which diminishes their emotional discomfort. There are several strategies of disputing or debating irrational beliefs. A few of them is by the use of lecture, the Socratic debate, humor, creativity, and self-disclosure. Now, the moment you dispute the irrational beliefs is the moment you develop an effective philosophy. So, this philosophy, following the ABC model, helps the individuals develop rational thoughts to replace and appropriate irrational thoughts. So you see, REBT uses an eclectic approach, meaning this is a combination of various techniques and approaches. Some are borrowed and adopted just to suit the needs of the client. So the principal therapeutic techniques that are used in rational emotive behavior therapy are cognitive, emotive evocative, and behavioral therapy. First is the cognitive techniques. Cognitive therapy attempts to show clients how to recognize their should and must thoughts, and also to how to separate rational from irrational beliefs and how to accept reality. Some examples niyan is Disputing irrational beliefs. Dito, the client will dispute a particular must, absolute should, or ought until they no longer hold that irrational belief, or at least until it is diminished in strength. Another example is doing cognitive homework. Yung mga clients ng REBT are expected to make lists of their problems, look for their absolutist beliefs, and dispute these beliefs. Yung mga homework assignments na to is a way of tracking down and attending dun sa mga shoulds and musts that became a part of their internalized self-messages. In this way, the clients gradually learn to lessen anxiety and to challenge basic irrational thinking. Next is yung bibliotherapy. This is a therapeutic approach employing books and other forms of literature. Ang advantages ng bibliotherapy is yung cost effectiveness, widespread availability, and yung potential of reaching a broad spectrum of population. Another is changing one's language. REBT rests on the premise that imprecise language is one of the causes of distorted thinking processes. So the clients learn that must, oughts, and absolute shoulds can be replaced by preferences. So instead of saying it would be absolutely awful, they learn to say it would be convenient if. So the clients who use language patterns that reflect helplessness and self-condemnation can learn to employ new self-statements which help them think and behave differently. As a consequence, they also begin to feel differently. And last sa ating cognitive techniques is the use of psychoeducational methods. The REBT program introduced clients to various educational materials such as books, DVDs, and articles in order for the patients to know the process of the therapy, how it works, and for them to be able to understand why particular techniques are being used. Madako naman tayo ito sa emotive techniques. So, these emotive techniques tend to be vivid and evocative in nature, and their purpose is to dispute clients' irrational beliefs. So, this include first the rational emotive imagery. This is a form of intense mental practice. In here, the clients are asked to vividly imagine one of the worst things that might happen to them and to describe their disturbing feelings. So this technique can be usually applied to interpersonal and other situations that are problematic for the individual. The clients who practice rational emotive imagery several times a week for a few weeks may reach the point where they no longer feel upset over these negative events. Next is humor. One appealing aspect of REBT is that it fosters the development of a better sense of humor and helps put life into healthy perspective. Humor has both cognitive and emotional benefits in bringing out change. Humor shows the absurdity of certain ideas that clients steadfastly maintain, and it teaches clients to laugh not at themselves but at their self-defeating ways of thinking. Next is role playing. In here, the therapists may interrupt to show clients what they are telling themselves to create their disturbances and what they can do to change unhealthy feelings to healthy ones. The clients can rehearse certain roles to bring out what they feel in a situation. And lastly is the shame attacking exercises. This was developed by Ellis. These exercises help people reduce shame and anxiety over behaving in certain ways. He asserts that we can stubbornly refuse to feel ashamed by telling ourselves that it is not catastrophic if someone thinks we are foolish. Practicing shame attacking exercises can reduce, minimize, and prevent feelings of shame, guilt, anxiety, and depression. In here, the clients may take the risk of doing something that they are ordinarily afraid to do because of what others might think. Through homework practice, clients eventually learn that they can choose not to let others' reactions or possible disapproval stop them from doing the things they would like to do. The last set of techniques that we have is the behavioral techniques. The first one here is the desensitization. This is a process whereby anxieties and fears are reduced by gradual, repeated, imagined, or real exposure to the nauseous stimuli paired with the relaxation, skill training, and other behavioral techniques. Another one is what we call the implosive therapy. This is a confrontation of phobic situations depending on the circumstances. REBT embraces experiential encounter techniques, and Ellis invented some of his own. Sa reinforcements and penalties, alam na alam naman natin, magbibigay ng reward kapag may ma-accomplish na task. And lastly, sa skill training, ito yung tinatawag natin ng mga workshops and groups kung saan ituturo dito yung mga social skills, for example, assertiveness training workshops. Yan, that could be helpful to the individual who are shy and find it difficult to have their needs met by other people. Down to our trends and updates. REBT was found to be both effective on children and adolescents, especially in reducing the number of disruptive events. Researchers also found out that the children benefited more than the adolescents. On to the effects of REBT, study shows that the longer the therapy lasted, the greater were the effects. A little saddening news, surprisingly, non-mental health professionals produce more change than mental health professionals. Now, REBT has been further adopted as an educational intervention, often referred to as REBE, or Rational Emotive Behavior Education, or REE, Rational Emotive Education. On a meta-analytical review of 26 studies found that REBE or REE reduced irrational beliefs and dysfunctional behaviors in the classroom and was more effective for children and adolescents than for young adults. Banks and Sean's 2009 show how REBT can be used with emotionally disturbed children and adolescents. Both Vernon 2009 and Wald 2008 outline practical and specific REBT techniques that can be effectively used with children and adolescents in individual, small group, and classroom settings. This is a case study about Chris who has problems in school. There were concerns on his ability to pay attention, staying in his seat during group work, and his talking out behavior. There were also some difficulty with concepts that were being taught. That's why Chris's teacher referred him for a psychological evaluation. The following are the tests administered to Chris. Here we have the WISC-4, Woodcock-Johnson Achievement Test, Thematic Apperception Test, Rational Sentence Completion Test, Children's Personality Questionnaire, Children's Den, Rational Emotive Behavior Therapy, Depression Inventory, Connors Rating Form, Teacher and Parent, and the BASC, a Self-Report Parent and Teacher Form. The Woodcock-Johnson Achievement Test results indicated academic achievement commensurate with his age. In the end, Chris was diagnosed with attention deficit hyperactivity disorder combined type. Based on the results of the evaluation as well as parent and child interview, the following treatment goals were established for Chris. Teach Chris an REBT-CBT framework including the ABCs to understand the interconnection of thoughts, feelings, and behaviors to help facilitate more effective emotive and behavioral responses. Another one is work with Chris to assume responsibility for his thoughts, feelings, and behavior. Next is teach him to identify helpful ways of thinking about things to replace the unhelpful ways he sometimes thinks about things, especially work on his beliefs about rating himself globally as a failure or loser, which may lead to his mild depression, tasks being too difficult for him, low frustration tolerance, which will serve to negatively impact upon his academic achievement, awfulizing about social rejection, which may heighten his anxiety and impair his social performance, and the demands of others' behavior, which may lead to social altercations. Next dyan is tuturuan din natin yung parents naman ni Chris ng ABC framework. We will work together with Chris' parents on parenting and contingency management skills, including techniques such as timeout, response costs, praise and other rewards, and token economy. Number 6, we will challenge Chris' demandingness of himself and others while emphasizing the rational alternative. Challenging an irrational belief while working on a rational alternative will help Chris internalize a new set of rational beliefs and connect these beliefs with more positive emotions and behaviors. Next is, in order to reduce the anxiety, we must dispute Chris awfulizing about peer rejection while at the same time providing social skills, training, and feedback. And lastly, we will develop an in-session token economy to improve attention and time on his tasks. That concludes my report. Thank you for listening.